Okay, we are recording everyone
Okay, excellent.
and still a little bit active in the waiting room, Leah.
It seems like it. In the meantime, the folks who have already joined us, if you would kindly go ahead and put your name and your organization in the chat so we can keep up with who is here, that would be greatly appreciated. Thank you very much. I see some folks doing that already. And it looks like somebody has an AI note taker. I know that we typically do not use the AI note takers in this meeting.
Yeah, that's right. I will try to remove.
Hello, everyone. Again, if you would kindly put your name and organization in the chat so that we are able to keep track of who is with us today, we would greatly appreciate it. And Netta, let me know when you are ready to roll.
Okay, I think maybe just a few, maybe another minute. We're still letting people in.
Seems like it's a good group today. I'm very happy to see so many folks joining us.
Yeah. All
For
right,
those who
Leah.
just,
Yep,
oh,
if you could, one more time.
okay. For those who just joined us, if you would kindly put your name in the chat along with your organization so we can keep track of the folks who are here. Annetta, may I start?
Yes, I think we're good. Thank you, Leah.
Excellent. So welcome to the October meeting of the State Advisory Council. I'm Leah Spangler. I am the co-chair of this group. I would like to invite you all to please participate in the meeting so that your voice can be heard. If you're a member of the council, if you would kindly keep your camera on during the meeting, that would be greatly appreciated. Also asking folks if they would kindly make sure they are muted. I know some folks attend this meeting and have littles in the background, and while we love the littles, sometimes it can be a little bit noisy. So thank you everyone for joining us today. First on the agenda is a discussion on the PA budget impasse and federal shutdown implications, which I am sure many of you are anxious to hear more about.
Good morning, everyone. I'm Shantae Brown, Deputy Secretary for the Office of Child Development and Early Learning. And as Leah noted, so good afternoon. We are in the middle of a state budget impasse and a federal shutdown. And really just wanted to talk about the implications that that has for our programs. You'll also note that that's probably the reason why you haven't heard from us the same way that you are used to hearing from us. So just first and foremost, wanted to note that the following programs have not received payment since July 1, which is the new fiscal year. That would include our pre-K counts and Head Start State Supplemental Assistance Program, and our early intervention programs. So I'll rewind just so I can talk a little bit about it, because we hear the rumors just like everyone else does. I know that some folks may have taken advantage of some loan options for their pre-K counts and their HISAP or Head Start programs, state Head Start programs. But as of today, I always tell my team, I give them the time and the date as of 1:03 p.m., 10/27. I don't have my glasses on. Let me put them on. 10/27, 2025. We are not moving any payments to pre-K counts and Head Start State Supplemental. I do know that some of our providers have chosen to take out personal loans and have been awaiting a response around paying interest on those loans with their payments or their future payments. They should be hearing from us about that shortly. But right now, Pre-K Counts Head Start State Supplemental has not received any state funding. The same is with early intervention. Now, there are some county payments that are moving. This is where it gets tricky for OCDEL. For infant toddler, early intervention, those services and supports come through DHS. And for preschool early intervention, those payments come through the Department of Education or PDE. Our preschool early intervention providers have not received payment for this new fiscal year. So since July 1, they have been implementing services and supports to our preschool early intervention through their contractors. Those contractors, many of those contractors have expressed a change in payment mechanism. Some of our preschool providers have been very clear that they can only continue to fund this program probably into maybe the end of the year. They've been very candid and have been telling different stories about the impact that it has for preschool early intervention. For infant toddler early intervention, those payments come through the county, and the counties have been receiving payments for some services, not all. So there's sometimes a little bit of confusion about what they're funding, but those payments, actual early intervention payments for either programs, have not been moving. And we're starting to hear from more counties than we have in the past about the implications that it will have. Some have had to furlough staff. Some have had to decrease services and supports on both sides for preschool and in infant toddler, but just wanted to be very clear that those payments are also not moving. In addition, our preschool development block grant, we usually refer to it as PDG for short, cannot move. I just need everyone to understand because there's been some confusion around federal payments. The Commonwealth cannot move any dollars without an enacted budget. That includes state funds and federal funds. So our preschool development block grant has also been impacted by the state budget impasse because we have not been able to move any funds to be able to do this work. So I believe there were a couple of outstanding projects, including some additional funds that we were trying to move for our startup and expansion grants. Those funds cannot move without a passed state budget. So those are the three pieces that I wanted to refer to when we think about the PA budget impasse. Those are all directly related to our state budget. And then I'll let Carolyn talk about the federal implications for the changes for the federal shutdown. I think it was Carolyn.
Yeah, sorry, I can
Okay.
I can jump on that now. I don't have any real answers. I hope Shantae didn't get everyone excited that I have some insight or some real answers, but we did want to share, in case you didn't previously see it, last week DHS issued 2 press releases regarding benefit programs that are going to be impacted due to the lack of federal funds. So the first is that SNAP benefits for November SNAP benefits will not be issued. So sharing that mainly for awareness, knowing that a lot of childcare staff utilize this program, and then also obviously families coming into programs are going to be impacted by this. So I can share that. I can share that press release in the chat. At this time, DHS is encouraging individuals to utilize PA Navigate, 211 or feedingpa.org in help finding food and other resources. And then another impact with the federal shutdown is on DHS's LIHEAP program, the Low Income Heating Assistance Program. That was scheduled to start November 3rd. And at this time, the start date is being pushed back to December 3rd. Again, another benefit program that staff are probably utilizing, families are definitely utilizing, and that program goes directly to utility providers to support households that are having difficulty paying utility bills, specifically in the winter months, since that's when costs go higher or are higher due to, heating needs. So I just wanted to share those two updates in case they were missed.
Thanks, Carolyn. And Kristen Rotz is adding some resources to the chat as well. Steve, I know you want to hop in here. I'm going to stop sharing.
Netta, notice there was one question from Diane Barber on CACFP.
Yes, I saw that question. I was actually going to wait until after Steve addressed the advocacy piece, but I can certainly answer it now. We have not received any updates about the impact of either the budget impasse or the federal shutdown on CACFP benefits and program.
Thank you.
Okay. Well, with that, I'll jump in here. Thanks, Shantae. I am Steve Doster. I am one of the partners in our broad base early childhood advocacy coalition, both pre-K for PA and Start Strong PA, that focuses on pre-K and childcare programs respectively. We have a broader focus on early learning as it relates to also the health side of the equation. So when you start talking nutrition programs like SNAP and those coming to an end, or not, the payments not going out, that's of concern too. But speaking broadly on advocacy, and there's many of my partners on here, Carol, Carrie, Kristen, feel free to jump in here. But we're trying to tell the story of this impasse. This impasse is bad for our children. It's bad for working families. But the thing that has the potential to outlive this state or federal impasse is the impact on the system. We had a teaching crisis in the early childhood sector prior to this impasse, and now people are potentially going off finding more lucrative, maybe even better jobs. Will they come back when this gets rectified? So we are trying to elevate these concerns in whatever means possible, telling the stories of the parents, telling the stories of the providers, telling the stories of the children. So just for example, last week, our campaigns issued a press release that we did a quick and dirty survey with as many providers as we could get to answer, recognizing that many of them that are facing hardships they're not in the office. They may not be checking email. They may be working another part-time job just to make ends meet. But we were able to compile that 95 pre-K counts and Head Start providers across 32 counties have taken out nearly $20 million in loans to keep their programs up and running. $20 million. Think about what the average interest rate is right now. That's a story we want to tell to the General Assembly. We also worked with Shantae's office, with OCDEL, to try to get a sense of how many slots are we talking about here that are not open. And they were able to do some targeted outreach to 21 lead grantees across 16 counties, and recognizing that 4,000 slots are either closed, delayed openings, or planned closures in that. So there are 4,000 potential children there that are not in an early learning environment, 4,000 or some number of families there that are also having impacts on can parents go to work. So we are trying to get those stories in a targeted way in front of providers. So one of the ways, one of the tricks with advocacy is always to make it convenient for those groups that are impacted to weigh in. So what we have up and running on our pre-K for PA website is, I'm going to try to share my screen. If you go to prekforpa.org and click on our Take Action page, we make it very convenient for you to weigh in. Right here is what we're talking about. It only takes a few minutes to weigh in here. educate your, encourage people to educate themselves on, why this budget impasse is further weakening. Record a video, tell your story. If you're a parent without care, tell your story. If you're a provider that's facing hardship, tell your story. And also, the most effective thing you can do is tell that story directly to lawmakers. So we have a one-pager here that really documents our concerns, sort of what I just articulated here on how this is impacting the stability of the system, how it's impacting families and their family budgets. And then we have the link straight on through to legislative activity there. And through this web page, this little section right here, you can record your video directly into our database. So we are trying to get those stories out through social media and directly pinging lawmakers to try to get this impasse behind us. So with that, I'll stop sharing. And Leah, I don't know if you wanted me to go into something a little more specific, or if you have any questions, but I'll stop there.
Steve, I'm just curious, is there anything that seems to be making a difference with legislators right now?
I would say, there's a lot of issues at play with an impasse. There's overall spend, there's politics, there's bigger buckets of money that are at play. And early childhood, just, it's a small percentage of a $50 billion budget. So I would like to think that our stories are help painting a picture of need that they need to do this, but if here we are facing November and we still have an impasse. So all I can say is if you have that connection, tell that story. That's all we can do here.
I can add that, we are also looking to the future, right? Because this has become somewhat of a norm, shall we say, some kind of a delay. So, this is the start. Collecting the stories is the start. We want to continue to collect data that really shows, the fact that the impact of this lasts beyond the impasse, right? As well, so that as we go into a new budget season, hope is that some of these stories that we tell will make an impact.
And the big thing, just Leah, to underscore what we would like people to reinforce, it's one thing to call up and say, we need a budget. We just need our money. We need to open. We need to be serving people. But let's not forget, this is a system that was in crisis before we got to this budget impasse. And we were very grateful of the investments that were proposed in the budget that would help with staffing shortages and other concerns within the early care and education world. And we want a budget that reflects that investment, that continues to strengthen the system and not just get money flowing. Getting money flowing is important, but that'll just return us to a crisis point that we faced prior to the impasse.
Thank you, Steve. That's a very good point. Does anyone have questions for Steve and his conversation about what's happening and how it's impacting us all? Steve, there's a note in the chat. Is that from you?
No, I just put in the chat, I was offering, we talked a little bit about SNAP at the top, how it impacts EC workforce, it impacts families in EC as well. And if anybody is looking for an easy way to chime in with the federal delegation in Pennsylvania about the significance of this issue, we partnered with Feeding PA to get something up in our Legislative Action Center. All you have to do is put in your address, and there's an email template you can use there to write to Congress. It is customizable if you want to make it a little bit more personal to why it's important.
Kristen, thank you so much. So now is the time to reach out and talk to the people that you know that are in the legislature and see what we can do to not only get them moving, but get them to invest in early childhood so that we're able to deliver the services that Pennsylvania's children and families need.
Yeah, and Leah, I would just also say, everyone on this call has a list of professional and personal networks, and go out to your list, explain to them, get people talking. Grocers are concerned about SNAP benefits because it impacts their bottom line. Tell your grocery stores to call their congressman. That just have these conversations. I was talking with the mayor of Lebanon over the weekend, and she's concerned about some of the things. So just in all of these conversations, you have the potential to get other people to act. So just serve in both action and getting others to act.
Thank you so much. So next on the agenda, we'll be transitioning to a section on workforce development. Louisa is first up on that. Louisa, are you with us?
Yes, good afternoon. Thanks for having me. I just wanted to give a quick update. I know that we've received a few questions regarding PDOs and priority list. So I just want to review that. This year, the PDOs did have a bit of a transition. There was a new RFA, and we had a transition in one of the regions. So understanding that period of transition was coming, and some of the PDG funds that previously were funding PDO were no longer going to be available. We wanted to provide a priority list for the PDOs to fund students. So I want to provide that to you all today, and then understand any questions or concerns that may be coming. So the funding priorities for the PDO, priority 1 is enrolled students who had completed coursework in the immediately preceding semester. And you'll see that terminology throughout this. For us, that immediately preceding semester could have been summer, or could have been fall or winter, but just that it was adjacent, who will have their educational goal completed within the fiscal year. And the focus for that, again, is on that degree or credential completion. We have someone who is engaged and invested, and so we want to continue supporting them to completion or to gain their CDA. The second priority is enrolled students who completed coursework in the immediately preceding semester and would continue coursework without a pause. So not necessarily that they would finish their degree or finish their CDA, but their continued progress is a funding priority for us, and they're actively engaged with this work. Priority 3 really speaks to the ability to recruit new folks into this field, and that's the youth pathway students. So they were engaged with the PDO under the youth pathway program. They graduated from high school. They continued to work in the field. They meet all of the priorities of the current requirements for PDO funding. They would be our third priority. And again, thinking about that as an opportunity to recruit and to retain those folks that expressed interest using the youth pathway. And then we transition to the next slide where we have priority 4 and 5. Priority 4 being pause students who are interested in resuming coursework. So thinking again, someone who maybe has some credits already, something occurred in their life and they had to take a break. But we want to, again, focus on the degree attainment and CDA completion. So we'd be building on what was already there with priority 4. And then priority 5, dropped or new students interested in coursework during the fiscal year. And again, they would have to be eligible for PDO funding based on their already established requirements. And then prioritization of those students is just the same as it's always been for PDOs, and those serving higher numbers of CCW children or currently STAR 1 or 2, working with quality coaches due to a certification citation for staff qualifications. So I think that there was some confusion about these priorities, so I wanted to share them directly with all of you. And I would also welcome any concerns or questions specific to a region or an issue within an ELRC. If you could let me know what those are, I'm happy to answer them and work through those concerns. But I just wanted to share more broadly this funding priority list for PDOs. I'll pause for any questions.
Just a quick question, Lisa. Is this priority list a function of, it is just for this year? A
It is
function of
for
the
this,
current
yeah,
funding landscape?
for this year is what we've set out. I can't guarantee that we won't have to also do it for next year, right? We'll have to sort of see where we are, but it is for this year. Thank you for asking that clarifying question, Kirill.
Thank you.
Mm-hmm.
Louisa, should we continue to have students apply?
Yes, absolutely. Please do. We work really closely with our funding partners to determine if someone isn't eligible or there's not funding available for that person in PDO to reach out to teach, or maybe they could use a Rising Stars tuition assistance so that we can continue to understand what that looks like. Additionally, the PDOs will gather a waiting list. And so the only way we can tell that story if we, need to support additional funding is understanding what the field needs. So please do continue to send interested applicants to the PDOs and to teach and to our funding partners. All right, thank you.
Do we have Aaron?
You're on mute.
Oh, sorry. I thought Leah was talking. I was gonna let her go. No, that's all right. I can get started here. Good afternoon, everyone. Just a couple of updates on the CQI awards for this year. The last date, just a couple of important dates. The 31st, this Friday, is the last date for a provider to either become eligible to receive an award. I'm talking about the star ones that are looking to become a star 2, 3, or 4. It's also the last date for current star 2 or 3 providers to move up in their designation to receive a higher award amount. Just so everyone is aware, November 28th, that is the last day for the ELRCs to send eligibility acceptance letters, and then the following week, which is, I believe, December 1st, that's the last available time for providers to sign those sign the eligibility and acceptance letters and get them back to the ELRC so that they can receive their award. Then looking out into 2026, providers will have until March 13th, I believe that's a Friday, to spend their award funds, and then there'll be some subsequent reporting requirements associated with that, which I won't get into today. So those are some of the important dates that are coming up. There was a question, I think, Netta, about how are we able to continue with CQI awards, just given all the federal, the state budget impasses, everything that's going on right now. That's one of the reasons is CCW, excuse me, our subsidized childcare program is designated as a vital human service program that we have to fund regardless of if there is a budget or if there is not a state budget. And another way of saying that is, we have to give our low-income families that access the service the ability to go to work every day. CCW is partially funded with federal CCDBG dollars. Why that's important is that CCDBG also funds our CQI awards. Since OCDEL can access the federal CCDBG funds right now to administer CCW, we can parlay that into creating access for the CQI awards and continuing with those without skipping a beat. So that's kind of just a little bit of the reasoning of why we can continue with CQI during this difficult time. I'll monitor the chat. If anyone has any questions or anything for me, please don't hesitate to ask.
Aaron, thanks so much. And that picture of the outdoor kitchen is really neat.
Isn't that amazing?
It really is. Where is this provider located?
I'm actually not too sure. I'll have to find out.
I'm glad that she shared pictures. That's very creative.
I can look it up while we're in the meeting, Netta, if you'd like. I don't
Okay.
remember off the top of my head, but she worked with her quality coach to make this beautiful space. And if you know folks that have used that funding, I'm just going to put a quick plug to have them share it with their quality coach or directly with us, because we love to see it and highlight it as much as we can.
Excellent. Thank you, Louisa. Next on the agenda is Phil with the workforce study.
Thank you. So within Pennsylvania's PDG grant, now in the final year, OCDEL tasked me and a research team at Penn State with completing a few of the grant's requirements. Those would be tasks which all state grant recipients must accomplish. However, in addition to those set of research tasks for all states, OCDEL included one additional research task within Penn State's scope, and that is a study of Pennsylvania's early childhood workforce. So not all states included a workforce study as part of the implementation of their PD award. And this additional research task is part of OCDEL's larger focus on workforce within the PDG grant. So this workforce study included many surveys and interviews which have been completed. Over 2,000 individuals have participated in our data collection through various efforts. The workforce study included an assessment of PD registry in terms of reliability and suitability for reporting and analysis. And then finally, for what we have today, the workforce study included an economic analysis of the PA labor market. And for that, Penn State partnered with Muhlenberg College. And I will now turn it over, actually, to Professor Greg Collins, who is Associate Professor at Muhlenberg, and can share a preliminary update from that work, which is still in process. And Netta, let me ask you, how much time would you like to set aside in the agenda for this?
So I had anticipated 20 minutes. If you need more, we're flexible, but we could keep it around there. That would be great.
Okay, that sounds great. So I will turn it over to Greg, who has slides, and hopefully we'll be able to share those. Thank you.
Yes, I had made Neil the co-host, so let me just find. Oh, Greg, thank you. I didn't even have to find it. You should be good to go.
Ew. In slow motion here.
It's coming around on our end. There we go, Greg.
We set.
Looks good.
Looks good. Good afternoon. I'm glad to be here with you and share some of the work that we've been doing in trying to understand descriptively the workforce in childcare and how that fits in with broader Pennsylvania labor force questions. Our three main aims were really to first just estimate the size of the workforce and describe what it looks like at a state level, and then try our best to understand local variation in the workforce. And finally, explore some of the relationships between the ECE workforce and other local economic indicators and demographic indicators to explore for whatever patterns we could find that would all hopefully be useful in setting policy around expanding access to care in the state. Depending on which set of numbers we use, we come up with between 45 and 50,000 people working in the ECE space. And in the perspective of Pennsylvania's broader labor force, that's about 1 in every 125 workers are working in childcare. And so in comparison, K-12 education is many times larger. And so from an attention standpoint, it certainly makes for part of the challenge, as we've already heard from our advocates group. Other related industries, social service occupations come in at around 120,000. Trying to find a workforce similar in size was actually a challenge, but legal occupations, including lawyers, paralegals, and judges as a group are similar in size. And so when we think about the ECE workforce, that's a comparable labor market in size. Interestingly, about 40% of ECE workers are working 30 or fewer hours per week. And so we'll call them part-time for the purpose of this. In some cases, it may be considered full-time work, but working fewer than 30 hours a week. This is a pretty sizable percentage of the workforce. We get into specific roles. The census has definitions set up for positions, and some of these breakpoints probably aren't so meaningful in the reality of the work that's happening. Whether you're a Class A preschool teacher or a child care worker, from one particular organization to another probably isn't too big a difference. But we were curious about the prevalence of administrators in this space and whether there was a greater or lesser share there. And based on the data that we've explored, about 7% of the workforce in ECE are administrators, which leaves about 80% working in direct instructional or childcare roles. And so again, these numbers are comparable to K-12 education in terms of the breakdown. One thing that's harder to gain traction on are the self-employed people working in childcare. And we've got some good data on those that are in licensed childcare spaces, those that are working in smaller home-based programs that don't require licensure. Getting good numbers on those individuals is tougher. And as we think about ways to draw them into the licensed space, be nice to have increased access to data there. And so we're exploring some other options on that particular front, working with a few other agencies who may have access to data through income records that could be useful, not in identifying individuals, but in putting some numbers around how many people are in these unlicensed spaces. Looking at trends, obviously we've got the one big dip. Growth has been slow and steady, and post-COVID came back pretty quickly so that we're only slightly today, only slightly under where the trend would have left us pre-COVID. And so the recovery has been almost complete. Despite ongoing challenges, we're not tracking a whole lot different now than we were pre-COVID in terms of our growth in the size of the ECE workforce in the state. The maybe most unsurprising finding from our work so far, but also I think the one that is just hard to overstate the importance of, is the magnitude of the workforce that's no longer part of the ECE workforce. Those people who spent time working in childcare and left the space. In the last 10 years, well, in the 10-year window that we were analyzing data, 2014 to 2024, 240,000 people worked in ECE in Pennsylvania. 240,000 compared to the size of the current workforce, which is, again, about 50,000 people. That means nearly 200,000 workers have shown interest in working in this industry, showed up, put in hours to become qualified to perform other roles in childcare and ECE, and are no longer doing that work. And on an annual basis, it's nearly 20,000 people who were there last year are not there this year. So when we consider where to find folks to fill these the vacancies that we have and to support extended growth so that we can serve more children, the place to start seems to be right here. How do we keep more of the people who are in ECE? How do we keep them in this space? As rough as it is, ECE is actually a little better than gas stations and restaurants. So we're not at the bottom of the list when we look at different occupations in terms of retention, but other roles that require more extensive training and more extensive formal education, ECE is struggling when it comes to retention. One of the places we explored using some data from labor and industry was the destination of the people who are leaving. And one of the things that we found was a surprising number of people who are leaving ECE are actually not working in Pennsylvania the following year. And that could be for a few reasons. One, they could have moved out of the state and relocated, in which case they would no longer be on those in-state numbers. but they may also have left the workforce for various reasons. From an age standpoint, about 50% of ECE employees in Pennsylvania are either 24 or younger or 55 and older. And so that 24 and younger crowd quite possibly are leaving as they start their own families. The recent bill introduced to provide more subsidized care and so forth to ECE workers could certainly help in meeting the needs of that particular group of folks. And then the 55 and olders are often leaving for retirement. And so when we think about the causes of attrition, of exiting the workforce, a large chunk of folks here may have reasons that are not just about finding a more attractive job. Of the half that are leaving for other employment, the biggest, most common destination is K-12 schools. And whether the individuals are certified teachers who are making a jump into the classroom there or are teacher assistants, role for role, compensation is better in K-12 schools than it is in ECE on average. And so it's not shocking that folks are looking to make that jump. But that is the most common destination for those who do go and get a different line of work. Family services was one of the few other social service industries toward which people were drawn. Otherwise, it was mostly traditional service and retail work, grocery stores and so forth, with a sizable number going to work for temp agencies. If we consider the policy implications and the policy levers that Pennsylvania could be considering, we thought looking at neighboring states and what was going on across state lines could be a useful thing. And so one map that we put together was looking at the ECE employment per under 5 population to get a sense of how many people we have working in the space for each child that's living in a given county. We'll have to ask Leah for what's going on in Cambria County there. We got a bright spot there. But one thing that jumped out at us from this map was what didn't jump out. We didn't see kind of the bold lines across state borders that we expected in New York and New Jersey, with considerably more funding and support going into their childcare and early childhood programs. There weren't sizable differences in the number of people working in that space. Just a read of anecdotal studies in New Jersey showed that the problems Pennsylvania's experiencing are really similar to the struggles in New Jersey. The difference in cost of living is likely a big part of this. New Jersey, on average, I think the living wage is about $3.50 higher. New York's is maybe $4.50 higher on average than in Pennsylvania. And so Pennsylvania's wages are lower, cost of living is lower. And so percentage-wise, the difference might not be all that meaningful if you're in the middle of each of these states. Qualitatively, some of our work on the narrow cost study that we've done in a few flights here, our conversations with folks who are in border communities in especially along the Delaware River find it hard to get employees to stay when they can drive across the bridge and make $4 more an hour just to meet minimum wage requirements. And so it is something of a challenge at those borders, but the differences in policy context don't seem to be showing up in terms of differences in employment in ECE. Looking at where Pennsylvania's childcare workers are, no shock, our urban areas account for more than half. Just looking at Philadelphia and Pittsburgh metro areas, account for more than half of the childcare workforce in the state. But as we explored more about what the labor force really means, and when we think about how to define a labor market, one thing that really struck us as important was examining how far people are willing to drive to work in ECE. Prior academic research looking at education workers, looking at low-income workers, looking at female workers, so that all of those groups have a strong preference for shorter commutes. They're willing to give up a little bit of pay to work closer to home. And so we explored Pennsylvania childcare workers' commute times and found that the average is about 15 minutes. And so trying to consider a county size labor market is likely too big. And yet most of the data we have on labor markets are multiple counties together. And so part of the challenge, we believe, is that having access to more localized data will be an improvement where it's hard to really gauge responsiveness to any one community. When we look at childcare deserts across the state, how do we find whether or not we've got sufficient people working nearby? It's difficult if we're thinking at even the county level. And so we've done some work to look at census tracts and to look at zip code level and so forth to try and estimate a little more locally. And so this is a map showing zip codes, just kind of driving home the importance of this. Different counties, Lackawanna County, the difference across counties are not quite as great, but still Carbondale folks are probably not commuting from Scranton to go to work in the northern reaches there. Berks County, very centralized around Reading, and smaller boroughs on the outskirts, not so. I highlighted Jefferson County here because even zip code becomes something of a challenge when we're looking at more rural counties where to drive from near Punxsutawney to the far north part of the same zip code might be a half an hour, 45-minute drive. And are people likely to make that decision in this space? Probably not. So as registry data continues to improve, hopefully our ability to use that to estimate childcare markets and where folks are located will be an advantage, and finding other sources to get us closer to the people really will be an important thing. One area that has revealed unfortunately little has been the relationships of the childcare labor market with other local economic indicators. We expected to find some really interesting things, and perhaps the interesting thing is that there haven't been so many of those. The childcare market seems to respond to where there are children, and that makes good sense. But as far as the labor force goes, there aren't stark differences based on incomes, based on education levels, based on other demographic measures. The only thing that I think maybe would be interesting to explore more, and we're going to do some with changes in demographics, are the Marcellus Shale counties. There's meaningful overlap with the identified childcare deserts in the state and those Marcellus Shale regions. This is one thing that jumped out as being unrelated in a way that was different from other industries. And so we'll do a little bit more work looking at demographic changes in those counties, but some on the ground qualitative follow-up is probably merited here. Some takeaways then. There are a lot of people in Pennsylvania who have shown an interest in working in ECE, working with children, and are no longer in that space. And so the more we can do to understand the attrition rate, and it's certainly easy to point at wages as a big part of it, and rightly so. What are the other characteristics that are unique to certain places that are hanging on to their childcare workers, that are able to attract and retain? What can we learn from them and hopefully roll out to a broader group? The geographical size of labor markets means continued focus on getting better, more localized data. Finally, one of the thorniest challenges for us in economic space in general is disentangling supply and demand. And so where demand increases, how responsive is a market that's normally when we're able to best detect true availability of labor questions versus a lack of match on price. And so we'll be continuing to explore for kind of sudden shifts and what's happened in spaces as demand has increased or decreased quickly. That gives us a little more insight into the market responsiveness. But I'm happy to take any questions.
Greg, that's fascinating information.
Glad you think so. Thank you.
Yes, I was curious about, it looks like over a third of our workforce is exiting the field on an annual basis.
Pretty amazing.
That's, I mean, that's very hard to make up for as an employer.
Yeah, it is a great challenge, absolutely.
Other questions from the group? This was such great information. I'm sure that there are many more questions.
Leah, I have a question, and forgive me if I missed it. On the advocacy side, we have been trying to put a number with perpetual or long-lasting labor shortages or teacher shortages that providers are experiencing. Did your research dig into quantifying, those sort of prolonged labor gaps?
You did not. And that's a
Oh, sorry. It appears Greg has frozen, and he's gone. We have, as part of this economic analysis, not looked at that specifically. We have tried to collect data on that and found it to be very challenging. For example, what would be your, asking providers, what would be your maximum enrollment capacity if you were fully staffed? That gets complicated with ratios. Asking how many staff they would like to have employed, as part of what they would consider to be full enrollment. That's a hypothetical that is difficult for us to assess, to actually calculate reliably. I will just mention also that even with something a little bit more straightforward like K-12 education, getting the number of not just teacher vacancies, but potential teacher vacancies has been challenging. So it is complicated, but I think maybe you could ask, maybe you could explain your interest in that question a little bit more, or we could have a follow-up conversation to see if there might be something that we can say, and along those lines.
Yeah, we can follow up, Phil. We don't.
Other questions from the group? Becky?
Hi, this was fascinating. Thank you so much for sharing all of this. I think my question actually is Brandy's question in the chat with a little bit of a follow-up around recommendations, including I think we got a little bit of comparison of against other industries, but if there's been any things that worked or sort of policy interventions that when it sort of looks the same, maybe like the restaurant industry, I know they're also looking at job quality, and wages definitely are a feature, but they are not the only feature of why folks decide to both enter a field and stay there. So I think I'm wondering, with Brandy's wondering about the recommendations and then any possible parallels between other places that have tried a few things out. Thank you.
Yeah, thank you, Becky. I don't know, Greg, if you're back on and can answer, but I'll just say that we certainly want this study and the work here and the findings to be useful, that can lead to recommendations. I think we also want to make sure that we are not coming up with overly prescriptive policy formation suggestions. What we will do is try to identify where are the drivers, what are the factors, what makes a difference, what matters, so that then others can also sort of really use these findings to develop more specific solutions. So if we identify retention as being a huge opportunity and can dig a little deeper into that and provide some more color and context, I think the recommendations would be along the lines of pursuing strategies that can reduce attrition, and other similar types of findings where we can point in the direction of where we see a lot of promise and opportunity to strengthen and expand the workforce, without necessarily getting into too much detail about it, what that looks like, which I think is beyond what the findings would support anyway.
Thank you. Diane, you have a question?
Yeah, it's just kind of a in the weeds question, of course, Phil. I would have an in the weeds question, right? And it was interesting about the Marcellus Shale piece, and part of me, not to kind of throw off what that could or could not mean, but I wonder about the demographics of the people who are working in the field in Marcellus Shale, and that Marcellus Shale, that work is done in more rural counties than it is in urban counties. So part of me says, are the workers who are doing drilling or whatever they're doing, are they bringing their families, or are they really, an age cohort that children and that extended family is not a part of it? So part of me wants to go deeper before I made some assumptions about that impact on childcare deserts.
Thank you, Dan.
Absolutely. Yeah.
Yeah, go ahead. Yeah, please.
Yeah, no, this is certainly a preliminary finding. It was a weird thing that stood out, and as we looked into the overlap, we saw it there. And so, but whether or not some of the retail and other service providers that set up to follow those workers might match, there were some stronger relationships with some of the hospitality and so forth. And so whether workers in those spaces have changed the dynamic or not is part of what we want to explore, just with general demographic shifts over the last 10 years. But yeah, absolutely, we'll approach that with skepticism, Diana.
Carol Austin also had a question about breakdown by age group of who is leaving and the length of tenure of those leaving.
We don't have great numbers because of sample size, and so we will include some look at that very thing. The size of individuals that we know about with some of these specifics gets pretty small, and so our ability to estimate well from the statistics we have is a little limited, but we'll share descriptively what looks like might be going on with an asterisk next to it to say we'd like to know better exactly what's happening here. It's a great question.
And just to add, based on the data and the reliability, we have to pick what to focus on. So, you could think of geography. Do you have it statewide, county, or sub-county? You could think of it in terms of, is it a single year versus a multi-year average, like a 3 or 5 year average? That helps give you more stable numbers, but it doesn't allow you to look at maybe changes over time if that's what you're interested in. And then there's subgroups. So while we're going to do work from multiple sources to describe the overall workforce, such as, age, educational attainment, things like that, to be able to do that in subgroups or in smaller communities is challenging. But given the importance of some of these subgroups, such as those who are part of the attrition, it's worthwhile to even look at some other data sets that may help us answer the questions for those more specific groups, even though it's challenging.
Phil, when will the data be finalized so that we'll be able to use this information?
The PDG grant runs through the end of this calendar year, which is quickly coming to an end. And then there will be a process of sort of peer review, publication layout, things like that, which will take time. So there will be some more opportunities. I think we can certainly come back to this to the SAC and share more. But in terms of the reports and findings, those will likely be out in spring of 26. So that would be my best guess right now, just going through the process of review and finalization and publication.
Any other questions from the group?
Thank you again for the invitation. Thank you, Professor Collins, our excellent colleague economist at Muhlenberg, and look forward to having more to share with this group in the future.
This is just so well done and informative and incredibly helpful. Thank you so much. So next on our agenda is the Certification Regulation Rewrite Project. And Louisa, welcome back.
Thank you. I just want to give a quick overview of our timeline for the Certification Regulation Rewrite Project. This timeline is available online and is updated frequently, but just wanted to bring it to this committee. So if you go back in time with me a little bit, this project started in October of 2021 and was supported through the Office of Child Care and the State Capacity Building Center. And through that, we were able to receive some TA and support with initiating this regulation rewrite, as well as some of the action items that occurred with it. We had some internal work groups that were selected to lead the start of drafting new regulations and wanted to be really intentional about having stakeholder input throughout the rewrite project. In November 2021 through April 2022, those internal work groups finalized and were assigned into subchapters to review the content of the regulations. We also held virtual kickoff meetings to announce the start of this project to the early childhood field, and the internal work group continued to meet regularly to draft changes in language for the regulations. Through April 2022 and August 2022, an ad hoc subcommittee reviewed regulations by subchapter and a full package to provide feedback. Again, that internal work group continued to review some of those feedback loops and made edits, and the initial process was reviewed by OCDEL leadership. In August 2022 through October 2022, draft proposed regulations were made public for stakeholders and for the general public to submit comments. This was an added step that was done in order to really engage the field in understanding some of the challenges with regulations and some of the things that folks would like to see and improved regulations in the future. During this process, OCDEL received over 1,000 comments during this extra level of engagement. Every single comment was reviewed and discussed by leads in the internal work group and by OCDEL leadership. And I can tell you, as a member who came into this process later after it already started, continued to be a source where we look to sort of see what the feedback from the field was. Moving on to October 2022 to March 2023, we had an initial DHS legal and exec review. Proposed regulations were reviewed by DHS legal and policy, and then we continued to make edits based on those executive reviews. In March 2023 through March 2025, we had our certification and quality assurance review, as well as review for applicability and burden. So throughout this whole process, we really have been intentional about thinking about how do these regulations apply, what added burdens do they propose to the stakeholders. And the other layer of review is really looking at school-age programs, school-age-only programs, and how the regulations might impact that specific provider group. Go to August 2025 through May 2026. a final review, and a plan to implement. So I can tell you as a member of the internal work group that we have spent many hours reviewing these and again, going through them with a fine-tooth comb through the lens of both folks in the field, right, with our certification team, from a policy lens as former providers, myself and Ruby both included, and really considering how this will apply to the field. The other layer that we've added is some of those feedback loops directly from providers, specifically as they relate to things like qualifications, right? And then in thinking about some of the career pathway work that we are headed into, really wanting to be intentional that some of our initiatives really align. So it is a very detailed process. I know all of you are very familiar with the regulations. I know when I was a director, they were bookmarked all the time, and I would probably look at them at least 3 times a week. But it's something that we're doing with a lot of intentionality. And then once our team has that final review completed, it will go through leadership review, exec review, and that includes OCDEL, DHS Legal and Policy, the Governor's Office, and the House and Senate. There then will be a 30-day public comment period, which we anticipate occurring the fall of 2026. And then we will be very intentional in developing TA materials for implementation and really making sure that the field is well aware of changes coming and how to come into compliance. In May 2026 through June, 2027 will be the publication of final rule. Final approval after feedback from public comment is incorporated. Again, that's that secondary public comment period. And then the publication of the final rule or the new certification regulations and implementing the training plan that I spoke to earlier. So implementing any supporting resources as well as technical assistance to providers to assure that they'll be able to come into compliance. And then finally, we anticipate these regulations being published and then providers having 1 full year to come into compliance to the new regulations. I know I breezed through that really quickly, but I'm happy to answer questions. And I know Ruby is here as well, but her voice is not fully here, but we're happy to support any questions.
Louisa, I just want to know, and I don't think Ruby would mind me saying it. If she does, she can always Teams me. But one of the reasons why it was really important for us to kind of review this rewrite is we have been getting a lot of questions around the cert rewrite and why we are off schedule. But according to the timeline that is posted, we're actually right on schedule, and we do acknowledge that it has taken some time and there have been some changes made to the timeline throughout this project. But just noting the why, it was really important for us to be able to collect lots of feedback from the appropriate folks that are going to be doing this work as we roll out this cert rewrite in a very unique way. This isn't just changing a couple of regulations or changing a couple of words. It's actually digging in and coming up with new chapters. So just wanted to acknowledge that. And kudos to the team that has been moving this work along, because we know that it has been a lot. And kudos to those that sit on the subcommittees helping us to do so.
Thank you, Shantae. I appreciate that.
Any other questions or comments from the group? This is from Carol. There have been a few public comment periods. Are there any additional changes made based on the public feedback during the August and May 2026 comment period?
So Carol, I think you're asking if we plan to make additional changes when we open it up for public comment period again, according to the timeline. And the answer to that is yes, we actually have to.
Gotcha. Thank you. When I'm curious as to when, because more input and I get it, but when is the final, and do we also get to see the final? Not for
So,
comment, but for viewing?
so, and I think you're asking, so after the public comment period, will we then re-release it for a draft again? And I would have to, I'm leaning on the team here, but I do not think so. I think the next time you'll get to see it is when we actually would be submitting it to IRC. The formal comment period would allow all those comments to come in, and then we would implement all the feedback just based off of the one that we did previously. It was like 1,000 comments. So we didn't re-release it after those 1,000 comments. We just really went in and kind of tried to implement all of that feedback. So it would be the same. We're actually required to do that by IRC.
So I guess my only other question would be, are all of the public comments going to be
Posted.
shared? So we can
Yes.
see all the different comments that people have made
Yeah.
and, okay.
Yes, we're actually required to do that per the public comment process.
Thank you.
Mhm.
Anyone else before we move on?
And I'm sorry, Ruby, I know you couldn't answer these questions yourself, but I just wanted you to preserve your voice.
All right, we will move on now to rapid response team next steps with Brandy.
Hi, good afternoon, everyone. Glad to be here to give a little update on rapid response team, the pilot update funded by the preschool development grant. I will just echo that the deputy secretary as well as Phil, briefly mentioned that we are approaching the end of the funding cycle for the preschool development grants come December 30th. So last week on Tuesday, the 21st, we had a rapid response team grantee meeting where Lisa and I co-facilitated and just kind of shared some closeout steps for those grantees. They do have all of their funding. So they are in the process of service delivery, setting up some complementary supports to the field as they approach December. So I just wanted to share kind of the timeline that they're on. They've got some budget and data due October 31st. The funding ends, right, December 30th. They need to have all those funds obligated by December 30th and invoiced by January 31st. And then all final reporting is due February 28th. And then that information will be kind of analyzed, hopefully in collaboration with Phil's team to include in the final report submitted to the ACF. Next slide, please. So really kind of that next step as we ended that grantee meeting was we had a report out, and I also created a survey kind of asking for updates from each of those grantee sites. There are 19 of them. Could they share any kind of regional sustainability plans? We want to be able to elevate any grantee or regions that are going to be able to sustain their approach with private funding or philanthropy or different kind of funding, so that we can ensure that our early childhood systems partners know what region is still going to have some sort of service, so that we can continue to ensure awareness and also collaborative efforts. And then once all the data is received, and we'll do some analysis of that data, lessons learned, and make sure that the State Advisory Council gets to hear those lessons learned, and then that'll be included in the final PDG report submitted to the ACF. Next slide, please. I did want to say, in an effort to kind of get some stakeholder feedback from different pockets of our system, I did participate in a quality coaches call in August where we kind of talked about rapid response and that the funding was ending. And we really wanted to encourage quality coaches to kind of share with us some themes from their perspective. So like you'll see 3 buckets: what is available, right? What is working, and what might be their wish list that they wish they had or they wish childcare programs had access to. So I just wanted to share with you some of those themes because I think that's part of our lessons learned. Many of the quality coaches work collaboratively with rapid response. They may have been part of that rapid response team. And so really wanted to ascertain kind of what their perspective was on rapid response and kind of the key pieces. And I think the biggest takeaway for me that I also see in both mental health consultation data as well as rapid response data is it's the person sitting next to someone in the classroom that really can be the most integral part of that intervention, so to speak. It's the validating someone, hearing them, seeing them, and working with them side by side. And so just really trying to hold that in mind as we learn from this pilot. And hopefully, next slide, just continue to use this data to support CQI across our entire system, and also strengthen professional development and practices and coaching and different supports that OCDEL funds through its office. So just really trying to get a bigger picture and seeing if there's a place where we can enhance our existing system. I will stay on for any questions or comments, or feel free to use the chat box.
Brandy, this is Andrea. I was just curious, what was the wish list around staffing and ratios?
It wasn't surprising. It really had to do with reducing ratio sizes.
Just a better support.
It was really, yeah, and
Okay.
about workforce turnover and reducing teacher-child ratios. Generally speaking, it was really thematic.
Gotcha. Thank you very much.
Any other questions from the group for Brandy? Netta, we have about 15 minutes left. Do we have time to review the early intervention and EITA information?
I was thinking let's skip ahead and do our public participation. Sorry. And then if we have time, we'll come back.
Okay, super. So from the group, we're asking you, what are you interested in seeing on agendas in 2026? And are there any remaining questions from today or any other topics that you would like to bring up while we have this panel of folks who are able to answer our questions?
And then State Advisory Council members, you can always follow up with us after, but we do want your feedback on what topics you would like to see, especially for the January agenda.
I do have a question for Brandy if she's still with us. Brandy, has there been, I'm just curious, has there been any particular funding stream that has risen up that providers are using or the former RRT folks are using to continue their work in communities? Is there anything that looks really promising other than philanthropy?
Not that I'm aware of yet, but I just put out that survey request, so I might be able to get it. I know that when they've asked me, you know, I've talked a little bit about, seeking support with the county, United Way. We have 3 SAMHSA project launch grantees in the state in specific regions. So, and some of them have reached out to those different funding sources. So it's not really clear to me yet where they might be ascertaining those additional funds for some sort of sustainability.
And will that be released publicly when the information is gathered?
That is a good question. I might kick that to Lisa or Carolyn. I would imagine it could be thematic that we would include that in our ACF reporting. That would also be public, but.
Yeah, I think we can definitely include that. And I think in some aspects it would be shared in our messaging on how these are going to continue past December 2025. I think, you know, each region will probably want to highlight, you know, how they're able to hopefully, you know, continue sustaining it.
Thank you, Carolyn. Any other items for discussion today?
For those of us on the call that aren't as familiar, the State Advisory Council has 5 subcommittees. We typically always do a subcommittee update at each quarterly meeting. We decided not to for this meeting because we had so much content to go over. But the last meeting from July, you can find those updates on the recording, and we'll have another subcommittee update at the next quarterly meeting in January. And I'm just going to back up to Kim.
So we really want to make sure that everyone has access to the early intervention complaint procedures. We pushed out this announcement at the very beginning of this year, and we have shared it far and wide and would like to continue to do so. We've shared it with all of our programs and providers, as well as advocacy organizations, our SEEP and SICC. We really just want to make sure that anyone who wants to file a complaint is able to find it and file it easily. So there are links to the complaint procedures as well as to the complaint form. And so if you hear of anyone complaining about their early intervention or, can help them in any way, please share this complaint form, help them fill it out if they need. We really just want to make sure that all of our families have access to report complaints if they are having issues with early intervention.
Any questions for Kim? And do we have another Kim with us who will be talking about professional development opportunities?
It's actually Deb Dalton.
Okay, I'm sorry about that.
No, you were correct. It was going to be Kim Katelis. I will step in here. Thank you. This has been a great meeting. There's so much good information here. I really appreciated being here for all that information. For those of you I don't know yet, I think I know most of the people on the meeting here. I'm Deb Dalton. I manage Early Intervention Technical Assistance, EITA. The EITA is a business partner with OCDEL, similar to the PAKey as a business partner. Our primary focus is training for infant, toddler, and preschool early intervention staff, as well as the OCDEL-funded home visiting programs and family support. And I'm going to do some really quick highlights on some of our training opportunities that might be the most relevant. Thing today is that we have some courses on the registry to make it easier for staff to connect to that. We also have a lot of resources on our EIT mobile, and I'll go over that quickly. And then we have a website we call our portal where we have actually courses. And then I just had a flash at my internet is unstable, so let me know if I'm not coming through well.
It is a little bit broken up.
Do you want me to turn it over to Kim, or what do you think?
I think since we're about out of time, maybe we can
tell me.
Go ahead. That'll be fine.
Okay, I'll do one more slide. These are, in that first bucket, our EIT courses that are on the PD registry for any early childhood person to take. They're the same courses we offer to early interventionists. So you'll see building relationships to support all children. Almost 3,000 people completed that course from the ECE workforce, not just the EI. Coaching across settings. Coaching is an issue with early childhood programs as well as early intervention programs. Embedded instruction for early learning. You see almost 247 people completed that course. Working together, early childhood and early intervention. 2,409 ECE staff completed that course on the PD registry. And again, focus on attitudes and beliefs. 2,205 CE staff completed that course. Do you want me to go on, Netta?
Sure, I think you can.
Okay, here's the app. You have time during this meeting. You have about 2 minutes left in this meeting. You can download this app. This is our app. It's probably the most valuable resource for people out in the field. It's really made to give you resources in the moment out in the field. So the resources on the IT mobile are quick little resources for you to go to. That's the first screen you'll see, EIT Mobile. If you then go to, I'm gonna put some arrows in there, Netta. If you go to the middle thing, which is tools, then you'll get this next screen and it will list a bunch of tools that might be helpful. They're very quick tools for using out in the field. There's tools around social emotional, which I know is an issue for EI and your early childhood. There's a nice app on developmental milestones where you can go to developmental milestones and sort by age range or so by domain, such as speech and language. Nice thing to share with staff or parents. And then the last one is self-care. We have a lot of resources around self-care in there. And I'll show you on the next page some examples. So the first line there is our social emotional resource on the mobile. So it means if they're on the mobile, they're quick and easy to access. Developing a plan with families around challenging behaviors, friendship skills, gathering information on challenging behavior, and teaching social skills. The next two in the next line are actually on our self-care button. If you click that button, you'll get very quick resources about mindfulness, self-care bingo if you want to do something for fun when you're stressful, and developmental milestones. All of those are on the app. All are very quick, easy to use resources. And then the next slide, we do the portal. That's our mothership, if you will. That's where all of our full-length courses are housed. And we have different topics of interest. This happens to be showing the social emotional. And there is our web address in the top. If you want to go to the next slide. That's our web address. And these are some of the social emotional classroom practices courses on the portal, which is our actual website. You see these are sort of big 5 here, 5-to-1 ratio, positive attention to negative, predictable schedules, routines, directly teaching the expected behavior, and teaching peer-related social skills. Those are courses. They are not as quick as the things you'll find on the app, but they do give you full credit for taking that course. If you want to go on, Dana. And then we always do virtual trainings as well this time. So here's 2 virtual trainings I thought might be of interest to ECE staff. So one is about strong beginnings around trauma and infant early childhood mental health. Those are the dates there. That's a repeat. It's repeated twice. It's open to anyone. You can log in on our portal to log into these trainings and sign up for them. And then next is building brains together with Dr. Robert Gallen. If you all went to the early childhood conference from OCDEL, Dr. Gallen was one of the keynotes. He's a fabulous resource. He's also the resource behind the infant mental health courses that we offer. So there's 2 dates for that particular webinar. And I think my last slide is, Brittany, everyone has access to the portal and the app and the courses. Courses can be found on the portal. The app is free and you can download for free. It's really easy to use. And these are just some upcoming social emotional trainings that you might want to access on the portal or in virtual trainings. My mouth is dry from talking so fast, but I'm willing to stay on and take some questions as well. I think the takeaway is really, we have courses on the registry. We have resources on the EIT mobile that are very quick, and we have courses on our own portal. So please access those. And if you have any questions, you're welcome to email me.
Deb, thanks so much for getting through that so efficiently.
So quickly.
So before we wrap up, Netta or Shantae, is there anything that you wanted to add?
I think I was trying to respond to Brittany's question. The question was, who has access to the EITA app, portal, and courses? And it's in the app. If you download the app, the apps are available in your app stores. So I don't know, I'm an Apple girl, so it's in the App Store, but it's also in the Google Play Store. You can download it, and all of those things that Deb was referring to is actually in the app and in the portal. Did I get that right, Kim, Deb? Okay. And just thank you so much for coming. We do want to make this a place and space where you get your questions answered, you get to ask some good questions, and that you get the resources that you need to be able to share with the folks that are doing this work. As far as just a shameful plug, because I know we can't do advocacy, but I do want to really remind folks that your legislators need to hear about what is happening in your agencies, in your centers from you directly. They don't want to hear it from us. They genuinely don't. There have been many times where folks are just very not interested in anything that Carolyn and I have to say. They want to hear from the folks that are doing the work. So please, please, please share your messages, share your challenges, share your hardships, because we hear about them every day, but it hits different when they hear directly from you. All right, that's my soapbox. I'm gonna get off of it and give it back to Leah.
Right. Thank you so much, Shante. So upcoming for your 2026 planning, our next meeting is on Monday, January 27th, which will be followed by quarterly meetings in April, July, and in October. So thank you so much for everybody's participation today. I think that that was terrific to see people asking questions and making suggestions. Just appreciate you being part of a meeting that was beneficial to all of us. Thanks so much, everybody, and I hope you have a great day.